So, good morning, everyone. My name is Dr. Brian Payne. Thank you for that introduction, Irma. And I'm also joined by my colleagues, Dr. Lewis Lockman, Dr. Forrestine Knows, and then our supervisor, Dr. Bridget Bailey. And we are from UT Health San Antonio. We're child psychiatrists. And, this topic is very pertinent, very timely, given that, we're about a year out from when this pandemic first hit. And we're all been struggling with how to maintain our wellness, how to be healthy during this time. So the hope of this presentation is that we'll be able to give you guys some actionable tips to be able to do well as we continue in this pandemic and make sure that we're staying mentally healthy and trying to keep those around us mentally healthy as well. Next slide, please. So for our outline, we're going to start with talking about COVID-19 and the impact that it's had on families. We're going to reflect on the prior year, and then we're going to look forward and discuss tips, again, to stay connected with everything that's been going on. We're going to review resources available for talking to children about COVID. And then we're going to look at some of the specific mental health symptoms that can result from this long-term stress that we've all been undergoing. And then we're going to wrap up in the end, just looking at overall strategies to support our mental health and wellness. And again, like I said before, just trying to, as this pandemic rages on, trying to figure out how we can all stay healthy during it. Next slide, please. So I wanted to start off by just giving an update on the current status of COVID-19. And as I was preparing for this presentation, I couldn't believe, we really are about 1 year out from when the World Health Organization first declared this an official pandemic. So that 1 year anniversary is actually coming up March 11th, 2021. So it's been a long time that we've been under these stresses. And we'll look at, kind of how that has been affecting us all in the future here. There's about 92 million cases across the world and about 23 million here in the US. And as far as deaths, there's about 381,000 overall in this country and about 32,000 in Texas. And in Bexar County, I think the last time I checked, we were around 1,500. And unfortunately, the cases continue to rise. So, we are hoping to have a into this, but as it's going right now, we're still in the throes of some difficulties. So some of you guys may have heard about some of the variants that have been out there. The UK variant in London, and then there's also another variant from South Africa. So what these are is they're actually mutations of the virus, and that's what viruses do. They mutate. So when you think about the flu vaccine and why we have to get the flu vaccine every year, it's because the flu virus, it mutates a lot. And what we're finding with COVID is that it's kind of following in the footsteps of flu when it comes to mutating. Which the bad news of that is the specific mutations for COVID, they've been found to be easier to spread. The good news is that even though it may be easier to spread, it's not the variants are not more they're not more deadly. They're not causing more death or more mortality. And the other good thing is that the current vaccines that we have that have been approved for use, current studies are showing that they are still effective against those variants. So that is a good thing that we have. And kind of looking forward to with the vaccines that we have on the market, they are easier to kind of change on the fly. So let's say that the virus did mutate and the vaccine wasn't as effective. The way that the technology is designed, they can be changed easier in order to make sure that the vaccine that will be put out is effective for it. So that's a good thing too. And speaking of the vaccine, of course, the purpose of this presentation is to not talk about that. I know there may be questions about it. But as far as availability, it is available now for those who are in phase 1B. Everyone in phase B includes everyone who's 65 years of age or older. And then, of course, those who are 16 and older, but also have chronic medical conditions. And that can include hypertension, obesity, diabetes, asthma. There is a whole host of conditions that can fall under. So if you're in any of those categories, you are able to get the vaccine. Next slide, please. So, what kind of things can we blame on COVID? And I'm sure everyone can think of a whole host of things. We've listed a couple of things here on the right. But as child psychiatrists, one of the big things that we see with our patients is just really not being able to engage as well in the virtual schooling, the virtual school setting. And what I've been hearing is that the kids, they'll log in successfully, but then what are they doing? They're looking at YouTube, they're playing video games. they're surfing the web, they're doing everything but paying attention to their classes. So it's just a lot easier to get distracted, in the home setting and doing it, the virtual way. So another big thing, of course, is this increased anxiety and fears. I was seeing not too long ago, some studies were showing that there's been a 30 to 40% increase in the amount of people going to their primary care doctors and mental health professionals because of worsened anxiety. And all of these are very valid fears, right? I mean, we've had, I'm sure some of you unfortunately may have had loved ones who have, been affected by or possibly even passed away. So there has been fears that, will I catch it? Will I pass this on to my family members who may be elderly in the household and more susceptible? So, definitely these anxieties and fears are justified. Then, of course, this goes without saying, we're living in unprecedented times. I think the last time that we've had a virus that was, this or kind of approaching the numbers that we're getting is way back when in 1918 with the Spanish flu. Um, Now, thankfully, this virus has, not has had a
Talking
high
about my
mortality.
son, the be
Oh, is someone not
oh,
muted or talking?
can you hear me?
Yes.
Okay, I'm sorry. I'm so new to this. So this is the first time I do a Zoom and I'm still learning. So this is a meeting for the behavior.
Yes, ma'am. So this is we're talking about family wellness and COVID, and we're from UT Health San Antonio to talk about that. Mm.
Yes, ma'am. You're in the right place. I know you may have been invited by one of the behavior implementation specialists, so you are in the right session. Thank you for coming.
All right. So, as I was talking about with this kind of the unprecedented times that we're in, we haven't had anything major like this since for the past century or so. So that, again, comes with its own stresses. We've had people working from home, having to juggle home life and school life with the children. And then, as I mentioned before, the having to suffer, the grief from possibly even losing loved ones. So there's a lot of things that have been, of course, negative and difficult to deal with this pandemic. Next slide, please. So it's not all grim news. There have been some benefits that have come about with this pandemic, and one of the biggest things that I think I can comment on is actually our presentation today and how we're coming to you all. This medium using Zoom and virtual meetings was something that was typically reserved for Silicon Valley, Google, Microsoft, Apple, the big tech companies. This is something that was kind of normal for them. But as far as us, and especially in our profession as child psychiatry, I can tell you before March, before things kind of started shutting down, I didn't see anybody via telepsychiatry. But since then, I can say that probably 80 to 90% of the children that I see are via, some kind of telepsychiatry or telemedicine medium, which has been great because, I've been seeing children across the state, whereas before they may have started with us and then they may move out of the San Antonio area, and they may have moved somewhere where there was not really much mental health services whatsoever. But I can still see those children and treat them and give medication. So that has been great. Another big thing that I think has been amazing. Again, this is not a vaccine talk, but the vaccine itself it's a modern medical miracle. I mean, there's no other virus or infection that we had within a year of figuring it out. We were able to have a vaccine available and on the market. And the technology used for that vaccine has been around for about 10 to 15 years. It will just apply to this, COVID virus. But going forward, the same technology to make these viruses can be used in the future to possibly have vaccines for other potentially fatal illnesses as well. So that has been some of the good things that have come about with COVID. Next slide, please. So I want to briefly review the stress response, as many of you may have heard it called the fight or flight response or fight, flight, or freeze. And one of the important things that looking at the stress response is what kind of effects does it have on our body overall? And just to kind of review very briefly, we have two organs that sit above our kidneys called the adrenal glands. And what the adrenal glands do is they secrete a substance called adrenaline, or also known as epinephrine. And what that does is that substance prepares our body in order to get ready to fight or flight, to do what we need to do in that certain situation. So you can think you're coming home late at night. Maybe you see a shadow in the corner as you're coming through the house, coming through the door. What do? Are you ready to fight off a potential invader? Are you ready to run if you can't handle the situation? So that substance, that adrenaline, helps your body do that. Now, the things that it does is it actually cramps down or causes your blood vessels to clamp down really tight. What that does is it increases our blood pressure, gets our heart pumping faster. So typically when we have something that stresses us out really fast, we get that, oh, our heart's beating out of our chest, we're breathing faster, we're sweating, our eyes dilate so we can take in more from the environment. And, all of that whole physiological process is very important so that we can do what we need to do in that situation. The problem comes, however, is when we have that level of stress and it continues to go on. It doesn't stop. And when you think about COVID, a lot of us have been kind of in this stress response for a while, for almost a year, like I mentioned a little bit earlier. So that's when we start to get into some of the negative long term effects of that, which we'll review on the next slide. So, we kind of split it up into mental health versus the physical health effects. But, the big things that we see in our profession, of course, as psychiatrists, is this increased anxiety and depression, which I alluded to a little bit earlier. Negative impacts in the home life, the work life, again, having to merge all of those together. A lot of times, it in and of itself can be a little therapeutic to, have children go to school, go to work away from the home, little bit of a break, from each other. But now everyone's just kind of all together, stir crazy, just not really having that time for personal space that we used to kind of unwind, and that has led to a lot of irritability. And unfortunately, that has led to increases in domestic violence and other negatives that have come about with just not being able to have that kind of like personal space. And then again, the biggest thing we worry about in our profession is, thoughts of self-harm and actual suicide, which comes again with, a lot of the stresses that everyone has been undergoing and unfortunately not really having healthy coping skills to deal with that. So that's on the mental health side. We can also look at the physical health side. And I kind of alluded this a little bit earlier when I was talking about the way that epinephrine works in our body. So what that does again causes the blood vessels to clamp down, increases our blood pressure, which is helpful in the short term. But again, when that's going on for a while, you can actually develop or have the condition high blood pressure. Our heart doesn't like to see our blood pumping at that, high of a pressure for a long time, so that can develop into heart disease. One of the things I didn't mention is that hormone or that chemical epinephrine is also responsible for increasing the amount of blood sugar or amount of sugar that we have in our blood. And what that is helpful for is our muscles need sugar in order to move, in order to react and do what we need to do. But the problem is again, if that blood sugar is if that sugar is in our blood for a long amount of time, and our pancreas is not able to secrete the insulin, which helps bring it back into the cells, then that can lead to diabetes. So that's another kind of negative outcome from having that hormone just kind of revved up all the time. And then the biggest thing or what may be a significant concern is that chronic levels of stress can lead to a lower immune system. And that's in fact the opposite of what we want right now. We want everyone to be as healthy as possible, right? So that our bodies can fight off the COVID infection. But unfortunately, when there is long-term stress that's not healthily dealt with, that actually lowers our ability to fight off infections, including COVID. And then, of course, asthma and arthritis are also included in here. It's just other conditions that can either be exacerbated by or worsened, or that can come about when there is lots of stress going on. Next slide, please. Let's see, are we able to get to the next slide? Or oh, there we go. Okay, so I wanted to take a chance for a little bit of audience participation here. So we're going to, I want everyone to take a chance to just reflect over the past year and specifically how COVID has affected you. So you can jot something down in the chat if you like. But hopefully I can get one volunteer just to kind of, verbally let me know this again in the past year, how has COVID personally affected you? I'll give everyone about 30 seconds to a minute to just kind of think about it, and then we'll ask for a volunteer at the time.
Well, I'll go ahead and volunteer.
Okay.
Um, well, for me, I live in New Braunfels, Texas, and because I have an elderly mother, I did
Hmm.
have to move to San Antonio, and she wouldn't move with me to New Braunfels because her immediate family is all in San Antonio, like her sisters and stuff. So I
Hmm.
moved my location and moved into San Antonio so that I could help her, and so she wouldn't have to go out of the house to buy groceries and all that stuff.
Hmm.
And so it's been a change because she does live in a two-bedroom house, and I have all my stuff, in storage and not fitting into her little house. And so it's been a hard change, and then having to go back to work and do a lot of hours online, and it's been
Hmm.
different and it's been tough, but we're making it. I've been blessed to have some good coworkers and family and friends that have been helping out. So we're surviving. So I'm very appreciative of that.
Awesome. Thank you so much for sharing. And that brings up, definitely a something that we've seen so much with the family environment that has changed, and how we've all have had to, whether it be taking in an elderly loved one or someone who may not have been able to take care for themselves. Whereas before the pandemic, they were fine, but now, they may need that extra help, and trying to juggle that with, okay, well, now we may actually have to look at, well, how much are we, how much is or what is the possibility of us infecting our loved ones, and we may be healthier, may be able to, withstand that versus our elderly loved ones who may not be able to. So that's definitely a great point. Thank you for sharing. Mm. I've been seeing other comments just kind of in the chat. Um, let's see here. Somebody said I've learned to slow down, so that's been a positive thing, and we'll talk about that a little bit in the coping slides. Someone said that it has amplified and resurfaced a negative habit of overthinking. Definitely, we've seen that a lot in our profession. Mm. Somebody said I wear a handkerchief before I leave the house. Definitely important to do, and making sure that we're wearing masks and social distancing. Okay, so thank you everybody for participating in that. So next slide, please. So, as far as the next reflection exercise, I want everyone to take a moment to think about not just how it's affected you personally, but how it's affected your family and friends. And we did kind of talk about that a little bit with our first example. So, just take a moment to think about that. You can continue the chat or use the chat function. And then I'll actually comment on this one myself in about 30 seconds to a minute.
Can I go ahead and say something?
Sure.
Okay. It's affected our whole staff.
Hmm.
Um, our coworker passed away.
Oh, my goodness. I'm sorry to hear that.
Um, Coach Jimenez, um,
Hmm.
10 years. So it's affected the whole staff pretty hard.
Hmm.
And everybody's trying to hold each other up. So it's affected us pretty bad.
Hmm. Yes, yes. I'm so sorry to hear that. That definitely has been the ultimate unfortunate, we'll say ultimate unfortunateness of this situation is when we have coworkers and loved ones, friends who have passed away. I think people who have been in our lives for so long, and just having to deal with that loss, deal with the grief, and again, later on in the presentation, we'll talk a little bit more about again trying to uplift each other and stay healthy, despite these significant stressors that we've all been under. So one of the things I wanted to reflect in my own personal life, I have an 18-month-old and a 4-year-old, and unfortunately, my own parents have not been able to see my 18-month-old. It's been really rough for my mom because she had two boys, me and my brother, and she always said that one of us should have been a girl because she's always wanted a girl. So, when me and my wife had our daughter, like my mother was overjoyed, like, oh, this is the girl that I've always wanted. We were planning for that first visit, I think right around March, April, May. And then of course, pandemic hit and everything kind of shut down. So it's literally like, again, my daughter's 18 months old and my mom has not seen her yet. And that just kind of like breaks her heart. We've been doing, the social media thing, but of course, as everyone knows, it's not the same as being in person and being able to do the hugs and kisses. So that's been really difficult. And even on the, my mother-in-law, my wife's family, like they've seen our children multiple times prior to when COVID hit. But even when I talk to them on FaceTime, it's like, oh my gosh, I'll never be able to see my grandchildren again, or I can't believe it. So a lot of reassurance that I have to give to my own, my parents and my in-laws, just about staying positive and doing the things that we need to do now, social distancing, or as I like to say, physical distancing, not necessarily social distancing, wearing masks and staying hopeful that we will get through this, soon enough. So, and then next slide, please. And then the next reflection is just looking at how this has affected our own or your own children. So you can continue to comment in the chat, and then actually we'll, for the sake of time, we'll go ahead and move on to the next slide. So the big thing that we want to look at now is just tips for staying safe and staying connected, right? Because we looked at some of the negative aspects, but how do we cope? How do we help out ourselves and help out our family during this time? So the biggest thing that I always emphasize to my patients, even before COVID hit, was maintaining a routine. Because what may happen, or what typically happens is even during the summertime, right? There's no school, our kids are staying up to 3, 4, 5 o'clock in the morning playing video games, sleeping in at 2 o'clock the next day. And by the time September, August rolls around, they're trying to get back into the groove of things, right? And then it may take a month, or sorry, it may take a week, maybe sometimes up to a month in order to get back into the groove of things. And during that time, falling asleep in class, not doing well. So I always recommend it, even pre-COVID, to maintain a routine, even during the summertime. Now you can have, a bit of leeway. You don't have to be a dictator about it. Okay, maybe you can stay up an hour later, on the weekends or during the summertime. But specifically with COVID, that COVID has essentially robbed us from our sense of normalcy, right? We do not have normalcy right now. So maintaining a routine is kind of a way to try to get back to that normalcy. In my own household, me and my wife get home around 6 or 6:30 every day. We eat, we have a little bit of playtime with the kids. Then after that, it is bedtime routine. So we brush teeth, we take baths, we read bedtime stories and go to bed. And that's been pretty much consistently throughout this pandemic. But again, that helps to kind of bring us back to the sense of normalcy. So maintaining a routine is an excellent thing to do. Another big thing is just staying active, right? It's easy for us to kind of stay in the house all day, not get around. But as I was talking about earlier, when it comes to your immune system, one of the big ways to counteract the stress is actually exercising. That can increase and boost our immune system function. So that's important. We've all been utilizing social media, and just by default, we've had to do this when it comes to doing FaceTime, again, Zoom. So just continuing to utilize those mediums in order to connect with loved ones around us, and being creative. Which I've seen some pretty cool things that people have done in the past, as far as like the drive-up birthday parties where there's a caravan of cars going down the street and waving hi to the birthday boy or birthday girl. And then Netflix and Amazon has these watch party functions where you can watch a movie with people across the country, same start and stop times, and kind of talk about the movie while you're watching it. So next slide, please. So this slide is just looking at how do we keep our family and friends encouraged. And the big thing is being available, right? It's easy to try to multitask and have our TV on or be looking at our phones. But really, we should be practicing active listening. And I do this in my own household by telling my wife, telling my kids to look at me as we're talking, because that way I know they're not distracted or doing other things. So that's very important in order to if there are are things that want to be discussed, or we are dealing with stresses and we want to talk to our family members about that, we need to be available for that to happen. And I mentioned a little bit earlier in the last slide about being creative, and then we've all just by default had to be flexible with what's been going on. So next slide, please. So as I finish up my part of the presentation, I just wanted to talk briefly about some of the resources that are available for children when it comes to talking to them about COVID. Sesame Street has a great website that has plenty of resources about specifically COVID. There was a special that ran last month, I believe, on CNN, just about the ABCs of COVID, which was awesome. And I think you can find that on YouTube. And it's also streaming if you all have HBO Max. They have that episode available. And then we'll have the CDC website, which is just a great website overall, just talking about COVID. But there's a lot of good resources specifically when it comes to children. And then also our own parent organization, the American Academy of Child and Adolescent Psychiatrists. We also have a fact sheet listed here that talks about how to talk to children about COVID. But the common theme for all of these resources is, again, like I mentioned a little bit earlier, being available. Kids are naturally inquisitive, which is awesome. And sometimes we can do them a detriment by trying to sugarcoat things or minimize them. But the biggest thing that we can do is stay truthful and try to model for them the coping and the healthy coping skills that they should be using. If we're using them ourselves, then our kids are also going to pick up on that. So that's kind of the gist of what a lot of these resources talk about, but they're listed there. So that's the end of my part of the presentation. I'm going to turn things over to my colleague, Dr. Forrestine Knowles, and she is going to talk about some of the specific psychiatric or mental health symptoms that can result from COVID.
All right. Thanks, Dr. Payne. I appreciate it. Good
Mhm.
morning, everyone. My name is Dr. Knowles. With COVID and the state of the United States, there are a lot of kiddos and families alike that are struggling with mental health issues. So we thought it was pretty important for us to just review some of the symptoms, some of the things that we have seen in our clinics and that families have been struggling with over the last year now. Um, for you guys to have an understanding of what to look for and when to reach out for help. Okay, so we're going to start with a review of these few diagnoses. There are a lot of diagnoses that have um, or mental health conditions that have become worse or more prominent throughout the pandemic, but we'll review these as they're the most common ones. Okay. All right. So um, fear, anxiety, stress, and worry. That's what a lot of families, lots of children are dealing with right now. Um, the pandemic and then politics have been very difficult for multiple families to explain to their children to cope with themselves. And so this is kind of where we are as a society. So all these things can culminate in pretty significant anxiety. All right, so this is just a fun, kind of busy, but really good visual for understanding what anxiety looks like, both in yourself and others. NAMI is an organization that has a lot of good resources. So if you want to just look them up online, it's NAMI, the National Alliance of Mental Illness. Feel free. I think it's a great source for parents and educators. But, as we can see here, lots of memory issues are a result of anxiety. So sometimes we'll think that kiddos have ADHD sometimes because they're having lots of difficulty in school, lots of difficulty focusing and concentrating in class. And a lot of times that can be a result of anxiety or even depression. Um, Overthinking is something that happens quite a bit. And I won't go through each of these, just the ones that I've seen quite a lot of. We have some panic symptoms, which we'll go over in another slide. But that looks like that fight or flight response that Dr. Payne was talking about a little earlier, sudden onset of difficulty with racing thoughts, racing heartbeat, difficulty breathing, and then significant, sometimes behavioral issues that occur during those attacks. And sometimes they're triggered, sometimes they're not. But this is something that we're seeing quite a lot of as well. Constantly worrying, development of what we call a generalized anxiety disorder, where kiddos are just worrying about everything because the stress that they're experiencing as a result of COVID, as a result of not being in school and having some sense of normalcy and structure, has worsened. And so now they're just kind of worried about everything because their body is in this very stressful state. And it's difficult to turn those thoughts off. Right? A lot of the time, we can also see some physical symptoms, not just in panic attacks or during panic attacks, but we can see physical symptoms long term as a result of anxiety. So, some kids have a lot of stomach issues, lots of pain, lots of kiddos and adults alike obviously get lots of tension in their shoulders and their necks and their backs. And so these are all things to look out for, both in ourselves and our family members, and try and get people to the right resources, to the right place to kind of deal appropriately with these things. Okay. All right. So here's our little review on panic symptoms. Um, there are a lot of individuals in the United States, about a quarter of Americans will have a panic attack at least at some point in their life, which is a pretty big amount. Um, and so, you can have suddenly tinkling in the hands, the fingers. That's something that I see with a lot of initial or first panic attacks. Um, Feeling chest tightness and pain. So it's really important for us as mental health care providers to make sure that we're differentiating between cardiac issues and panic symptoms. So we may send you to you or your child to your pediatrician or to your family care provider to make sure that we're not missing something, because a lot of these symptoms mimic other conditions that are very serious, right? So we need to make sure we're ruling certain things out. Racing heart, like we talked about, sometimes we can feel sweaty or chilled, which can honestly mimic COVID symptoms or flu-like symptoms. Feeling out of control. There's a very commonly a sense of impending doom or death. So that fear that everything is going wrong and there's nothing we can do to fix it comes on very suddenly. And then difficulty with breathing, ringing in your ears, nausea, dizziness, and then feeling weaker, also some common symptoms of a panic attack. Um, so if you're noticing these things in your family members or in yourself, I would say don't just sit on it. Reach out for help. Use some of the resources that we have listed in this presentation. Utilize the resources that the school district has provided for families and kiddos alike. And let's get on be on top of these things so that they're not getting worse, because there really is no set end date for this pandemic, and we need to learn how to deal with it while we're in the midst of it, as opposed to waiting for it to end. Okay. All right. Another very common thing that we're seeing is depression. And we'll just move past this. All right. So here's some of the symptoms of clinical depression. The most common thing right now that we're seeing is a change in normal sleeping patterns. So without the structure of school, without the regular structure of work, we're not getting up, we're not getting dressed, we're not leaving our homes every single day, and we're sitting at home. So it's really difficult to kind of normalize a schedule and get to sleep on time. Our bodies are not feeling the same or experiencing the same level of exertion. And so that can really ruin our sleep schedules, in addition to just not really knowing what to do with ourselves throughout the day, right? So if we finish our work or we have access to the internet, or things are not the way that they usually are, and we don't have set times for different activities, we can nap during the day, which will ruin our sleeping schedule. We can sleep too much, especially now that it's daylight savings time and it's getting darker out a lot earlier. So all these things kind of play into a change in the normal sleeping pattern, and the depression makes that so much worse. Okay. Random outbursts of tears or anger, if you have family members or you yourself are having a really hard time regulating your emotions and you don't really know exactly where it's coming from, this can be a sign of depression. Okay. Of course, thoughts about suicide or death as depression gets worse are frequent and common. Feelings of despair or sadness, and then something that we're seeing a lot of, especially now that we're so isolated and we can't get out to do the things that we like to do, is a loss of interest in enjoyable activities. So kind of um, the the limitations that COVID places on us, just because we're supposed to be isolating and socially distancing, um, on top of depression, makes that loss of interest so much worse and troublesome for families. And then it makes it difficult to kind of get out of that pattern and to go and participate in those things and to activate ourselves to get out of that pattern, to get out of this depressed mood if we're in one. Um, Also seeing lots of lack of energy, appetite, and concentration changes as well. Okay. All right. So, just some tips on how to recognize depression in others. If we're noticing people expressing more negative thoughts, having a generalized difficulty kind of experiencing positive emotions. So, if something good is happening, if everyone around you is laughing and there's one person that's not, and that's consistent, kind of look out for that. Okay. Those are things that kind of are signs of depression for us. When I interact with patients, sometimes I'll make jokes on my computer as we're interacting through telehealth platforms. And if I'm noticing that I'm not getting that kind of laugh or chuckle back, that's a sign to me that I need to be mindful that I may be dealing with a patient that's experiencing depression. Okay. Loss of confidence, self esteem issues are really big right now. Kids are on the computer more, adults are on the computer more, and social media makes self esteem and confidence really problematic. Okay. So, all these things are kind of playing into uh, worsening of depressed moods or more prevalent, more prominent depressive features. Um, Looking tired and fatigued, not taking care of yourself. So, you know, one of the things that Dr. Payne mentioned and that I reiterate to my parents a lot, make sure kids are getting up, make sure you're getting up and taking care of yourself. Every single day, take a shower, make sure that you're getting dressed, because eventually when we don't do these things, we're kind of priming our body for getting into one of these depressed moods, for feeling some of these mental health issues that we're talking about. Okay, and then of course talking about death or suicide, lots of memory problems, and then missing work and school. Lots of kiddos are having a very a significantly difficult time dealing with being in school virtually. And when it's too hard and they're feeling really defeated, they'll often just miss class, not sign on, exit class, and not get back into the Zoom session. So these are all things to look out for. And then PTSD is another condition that we've seen kind of flare up during COVID. So, just for context, it's not necessarily that COVID is causing PTSD. It's not necessarily, it can be very traumatic for some people depending on what they're experiencing in their family, in their life. So, if we've lost a loved one, if we ourselves have had COVID and it was very difficult, that can, of course, cause a lot of issues and that can be traumatic. But people with pre existing PTSD or trauma symptoms can experience or re experience those past traumas because we're in a very stressful time. So, individuals that have a trauma history, anytime there's a big stressor, anytime there's uncertainty, anytime there's fear, or a lack of structure, those symptoms can recur. Okay. So, we'll go through a few of these. These are 4 categories that we look at, and we kind of go down these lists and ask our patients, are you experiencing any of these things? So, intrusion, really just nightmares and flashbacks about past traumas, about fear of what's going on currently. Those are more prominent. Um, Avoidance, so sometimes just not people about the things that we're experiencing, or avoidance of certain situations, of certain people, of certain places. Those things can get worse. So sometimes people have, especially with veterans, they have a really hard time going into big stores. Right now during COVID, a lot of people are fearful of going into big stores. So if we're noticing a really big pull or push not to do some of those activities or go to those places that we need to go in order to get our goods to survive, then that can be a sign that trauma symptoms are worsening. And then a lot of these cognition and mood changes are very similar to depression. And so feeling isolated, memory problems, not or having a really difficult time experiencing positive emotions, all of those things occur as well. And then we have arousal and reactivity changes. So similar to depression, irritability, and aggressiveness, insofar as families or individuals have a hard time with emotional outbursts. So, not really knowing where some of this irritability is coming from, but having sudden outbursts of anger, that's common. Being hypervigilant, meaning being on guard, not feeling safe in multiple different situations, despite whether or not they're safe. And then we see problems with concentration and sleep issues as well. Okay. There's also a point here about self-destructiveness, and I don't know if we go through this at any other point in the presentation, but this includes alcohol, drug use, doing risky things. All of these things are sometimes they're used as self-soothing methods. So we drink alcohol to make thoughts go away. We use drugs to make thoughts go away, to make ourselves feel better, and these things can be worse when individuals are having a hard time with past or current trauma. All right. So just again for to reiterate, just recognizing PTSD and the loved ones and our friends around us, anger outbursts, sleep problems, depression, anxiety, feeling isolated or disconnected, and then those re-experiencing symptoms, nightmares, feeling unsafe or hypervigilant, and then talking about death or suicide as well. All right. And we're going to talk a little bit about grief, just because obviously this is a really difficult time. Many deaths as a result of COVID, and lots of families and friends are being affected. So I actually have some of the symptoms of grief. Um, Grief is expressed physically, emotionally, socially, and spiritually. Um, a lot of the same symptoms that we've been talking about with anxiety and depression are prominent or present in when individuals are experiencing grief. Okay, I won't go through these in detail, but I will talk a little bit about the spiritual expressions of grief because those are a little bit difficult to deal with, and it's not something that we talk about too much. It's There's a lot of questioning for the reason that there is a loss in the first place. I've noticed that a lot of people are angry because they feel like a lot of things are preventable, and they don't see other people taking it as seriously as they have been because of their loss. They're having a hard time understanding the purpose of life, the meaning of death, and adults and children experience this, right? So it's important for us to be talking with our kids, with our teens, with our little children about what all of this means to the as easy as it can be, depending on their understanding of what's happening. Okay, all right. And I'm going to actually skip this video, but I do, just for the purpose of time. But if you look on YouTube, just for how to give advice to a grieving friend, I believe this is by Brene Brown. Really good advice. To sum this up, just being there for the individual that has experienced the loss and not necessarily trying to sugarcoat the situation, but rather sharing in their grief. Is one of um, the best ways to help somebody that is having a really hard time. So not necessarily, and we'll go to the next slide. I think there's some tips. Um, so sometimes we have a tendency to try to make things better. So we say things like it could have been worse, or you need to move on after somebody's been sad for a little while, trying to find ways to make them feel better immediately and not allowing them the time to actually process their grief and to be sad, which is a normal process and it's healthy to experience that. So just being there with the individual, helping them by just experiencing and going through their grief with them, saying, you know, this does suck and I'm here for you for when it's really hard. Um, that's a little bit better than making it feel better because it can make that person not want to come to you for guidance and for assistance because they feel bad that you're trying to make them feel better, or that you're making them feel the grief with them, right? So letting them know that that's okay, that you can be with them and share in their grief, um, is excellent and helps people feel supported. Um, all right, I'm going to give Dr. Lockman a little time. Are there any questions so far? We haven't had too much time for questions, and we have just a few minutes for Dr. Lockman to go through this last section. Okay, all right, I'll let him take over.
All right, appreciate that, Dr. Knowles. So yeah, like Dr. Knowles is saying, my name's Dr. Lockman. Thank y'all for allowing us again to speak with y'all today. We're just going to talk real briefly about mindfulness and well-being, given we are a little crunched on time. So next slide, please. One more. So yeah, mindfulness is being in the present, being in the moment, being mindful of the situation that's going on, not being lost in the past or worrying about the future, just kind of being there. And we often encourage our families and the kids that we work with to try to be mindful in difficult situations, to center them back and to bring them back into the moment, because sometimes it can get overwhelming worrying about the future, or sometimes it can just be overwhelming thinking about things that happened in the past. And when we do those things, sometimes we miss out on what's happening right now and also how to calm ourselves down right now. Um, so, we're going to talk about how to help our well being in regards to that, and how just to help our overall situation. So, well being is a state of positive mental health. It helps us feel together, empowered, happy, satisfied, and like we can live our lives the way we want to the fullest. And having a sense of well being is actually a positive predictor that in the future things can be successful and you can achieve in a variety of, we'll say, domains or areas in your life, whether it's personal, professional, you name it. Having a sense of well being and having well being can help you in those different domains. Next slide. Like I was saying, it's positive in the predicting, but it also is a nice motivating factor. Having a sense of well-being and feeling like we can take on challenges and that we're empowered and that we can do these things will allow us to learn new things, seek out new opportunities. It may allow us to reach our fullest potential and be more creative or productive, whether it be in our home lives or our professional lives or as parents. It might help us solve problems we wouldn't be able to do assignments that we wouldn't be able to do, parent in a way that we wouldn't be able to do if we weren't feeling so well or if we weren't feeling, our best. And also importantly, from the medical side of things, having a sense of well-being encourages us to stay with what's, our prescribed treatments. If we're going to therapy, kind of engaging in those tools the therapist might give us, or just, doing what our doctors tell us, whether it's medically or psychiatrically. And we kind of see that well-being overall has positive outcomes. Like I was saying, we might feel more motivated to do things. You can go to the next slide, Dr. Knowles. Do things to include being socially connected, talking to our loved ones, talking to our friends, even if it is via Zoom or FaceTime. And we know social connectedness not only helps our well-being in the moment, but also decreases the risk of mortality, aka death. And in some degree, having this sense of well-being can actually encourage us to be more physically active, whether that's exercise, whether it's in our home gym or taking a walk outside, being safe and socially distant with masking. But that can control our physical fitness level and our overall medical and overall well-being, as exercise in general can help us. And like we talked about, people who are satisfied in life also want to continue to lead a satisfied and healthy life. So they tend to be more preventative in what services they're reaching out for. AKA, you might be more motivated to go to your doctor for your annual exam if you're feeling good, to make sure that you keep feeling good. Next slide. Well-being can, like talk about, promote positive relationships. When both parties are happy, or all the parties in a given relationship are happy, that relationship tends to be more satisfying and tends to have better behaviors. Um, Partners, and whether it's in terms of relationship between partners or the parent-child relationship, if both parties are feeling more well, they tend to use more positive and supporting methods and helping each other and coping, working out conflicts when they do occur, because as we all know, they tend to pop up even if they are small. And the better we're feeling, the better we are able to navigate those. We also know that well-being and having a positive sense of things can help likely more promote healthier relationships. And that's possibly connected to the reduction in interpersonal violence, interpartner violence, divorce, and some criminal acts. Next slide. Okay. How can we make ourselves more well? There are a lot of ways we can do this. Practically, we like these methods to be low cost, easy to do, take little time, because we all know we have busy lives. But we also want them to, like I said, as easily done, be able to kind of do these repeatedly. And over time, these small interventions can add up to a big change. So one of these exercises can be a positivity activity or a positive activity, expressing gratitude or kind of envisioning a bright future, which I know that can be hard to do in COVID-19, as like Dr. Payne said earlier, has been going on for a while, but keeping up that hope that things can continue to get better, and kind of picturing in our mind where we'd like to be, even if it's not next month, in the future, what we'd like to do again, whether it's hugging our loved ones, being around our friends, or just, going to the movies and seeing the latest movie. So some like low-lying activities, some low-level activities to help promote our wellness, simple meditation, time to yourself, being present in the moment, being mindful. Some techniques to do this might be deep breathing. We often encourage kind of a triangle breathing in through our nose for 3 to 4 seconds, holding that for 3 to 4 seconds, and then breathing out for 3 to 4 seconds through our mouth. Kind of really getting lost in that breathing cycle that bring us back to the moment. And after we kind of engage in this mindfulness and we've done some meditation, we could reflect on what we're thankful for, or what blessings or gifts that we have in our lives. Kind of a step up above that, we could write down the things we're thankful for after this, kind of put pen to paper and not just, think about it. The step above that is actually engaging in acts of kindness, whether it's like Dr. Payne was talking about, doing those drive-by birthday parties where everyone's waving and, saying hi to the kiddo or the grandparent or whoever that, we might not be able to see in person, video chatting an old friend that we might have lost touch with, or even just checking in with someone, seeing how they're doing, trying to do our best to be kind in, the best way we can at this, kind of unprecedented time, trying to maintain that social connectedness and, pick up the spirits of other people. And that can help us feel a lot better too. Next slide. And just kind of real quick, like we were talking about, because I know we're running short on time, resilience is, the ability to bounce back or recover from difficult situations like COVID-19. We all know this is a difficult situation, but we can bounce back from it and we can recover from it and still do well, even if things do get tough from time to time. Next slide. How do we build resilience? Complex answer, but it helps when we're taking care of ourselves, taking time to ourselves to engage in our interests or hobbies, talking to others, not being isolated. Humor is a great mature defense mechanism to help deal with difficult situations. Setting boundaries and making sure that we're taking care of ourselves in difficult situations and just not letting others take advantage of us or something like that. Having good people around us to help pick us up and help push us in the right direction when we are feeling down. And like a lot of your doctors will tell you, a good exercise program, good nutrition, and good sleep are all cornerstones to making sure that your body feels well, your brain is feeling well, and those three things are critical to maintain even in the toughest of times. Next slide. All right. And I know we've harped on this a lot in terms of when someone might need help. Um, Dr. Knowles talked about signs of depression, anxiety, post-traumatic stress disorder, and grief. Here are just a few of them here. The big thing is if you think people need help, we encourage you to please reach out for help. And if you want to go forward a little bit, Dr. Knowles, we can kind of show them the resources which families could utilize if they need help. Um, Here are some basic resources for COVID-19 wellness. Um, healthychildren.org, CDC resources, and the city of San Antonio. Like Dr. Payne was saying, a lot of these encourage interaction between families and children. And all of these have great ways to offer support, but also um, find ways to communicate with your kids even in difficult situations like pandemic. Next slide, Dr. Knowles, please. Here are some crisis resources. These could be utilized if you're fearful your child might be suicidal, might harm someone else, might be severely depressed or anxious, and you think it's a crisis where they need help right then and there, and that just can't wait. Or if you had any emergency concerns, Clarity Child Guidance Center, San Antonio Behavioral Hospital, and Laurel Ridge Treatment Center, they all have crisis centers that you can go to, and there are the numbers you can call to get instructions on how to engage with them if needed. Also, the National Domestic Violence Hotline, a 24/7 option if you're either experiencing domestic violence or you're concerned someone else might be and you want to know how to help. These resources are 24/7 though, so I know they'll be putting this presentation up, so whether you Google these or look these up, these are important numbers to have in the back pocket. Next slide. And here are some other resources. I know SAISD has a great list of resources they could offer y'all if you need something, whether it's counseling or psychiatric or medical care. Here are just a few of them. Down here, it got cut off. We also have the suicide prevention line, free, confidential, 24/7, where people could call to get in distress prevention or to get crisis resources. We also have substance abuse treatment lines, like Dr. Knowles is saying. Sometimes substances get involved and people try to deal with difficult situations. And we also have just various support lines. And again, we do appreciate y'all inviting us to speak with everyone today and being such a wonderful audience and participating in our activities. It's definitely our pleasure to do to help out and engage y'all. Thank you so much again. I know we ran over, so I do appreciate your valuable time.